Infection control is huge these days, and it actually plays a crucial role in ensuring patient safety in an audiology practice. In this video, I'm going to explain the steps that we take at Ear Studio to make sure that we do everything we can to avoid the transmission of pathogens. Welcome to Earman Dan. If you're new here, my name is Daniel and a very warm welcome. I'm a hearing care professional and the owner of Ear Studio in Castle Hill in Sydney. But more importantly, I spend my days helping people, not just to hear better, but actually to understand better and leave behind the challenges of hearing loss. And in this channel, I break down how hearing really works, how the hearing care landscape looks in Australia, and what you can do to get the best possible outcome. Now, I invite you to follow along in this journey. Now, when it comes to ear hygiene, infection control should take a priority, really. While not exactly a cheap process and not also easy, it's just one of the things for me as a business owner that is extremely important. We see around 2,000 patients every year for earwax removal procedures, and therefore I take that topic extremely seriously. And probably I go above and beyond most practices in Australia. Basically speaking, anything in our clinic that enters the ear of a patient, especially reusable items, they must be cleaned and they should be sterilized. Now, not everyone is doing that, as the equipment that you need for that is often quite expensive, and the process to clean and sterilize items, it's very time-consuming. So the temptation is just to use a quick alcohol wipe to clean off instruments. And while that's better than nothing, it doesn't quite suffice for the standards that I have for my clinic. Let's, for example, start with water. In some cases, we need to irrigate the ear canal. That is especially needed when eardrops have been used, or if the wax is very wet and soft, or if it is attached to the eardrum. Now, in those cases, we can't really use these instruments directly on the eardrum, especially if they are made out of plastic or metal. We just can't scrape anything off the eardrum. We should never touch it, really. We have to use water in combination with microsuction. So at that stage, we are essentially introducing a foreign substance into the ear. And while the water comes out of the tap, I wanted to show you what's behind the tap. Why that is important is because water can, in some cases, especially when it runs through a hot water heater, for example, it can contain certain bacteria or even viruses. And for some of our patients, for example, when they have very sensitive skin, or some of them may have even been diagnosed with diabetes and they are a little bit more prone to infections, or when the skin in the canal is cracked, we need to be extremely careful. In most of those circumstances, we actually want to avoid the exposure to water, but in some cases we are asked by their treating doctor to make sure that we clean everything out before they commence treatment with drops, for example. So while we use water that comes out of a tap, behind there's actually a 3-stage filtration system and then a UV sterilization system in the cold water supply line. So any drop of water entering our premises is filtered to a 1 to 5 micron unit, and it's then sterilized using a UV element. The result of that is that 99.99% of bacteria and viruses, as well as all the sediments that are normally in water, are filtered out. To make 100% sure, we've also added an additional filter element directly behind the hot water system. So basically, before the water enters a client's ears, it has run through 4 filter elements and a UV element that sterilized the water. And you can't really do more than that. Using a system like that, we know that the water is extremely clean and that any bacteria that normally exists in the environment is higher than what we introduce into the ear. And that is just one of the things that I can control. There are a lot of things in this world, as you know, that are outside of our control. But I take the approach that the things that we can control, we should. Now, the other things that we use in the ear are instruments. Now, these could be, for example, speculars. We use these to look into clients' ears. They could be instruments that we use to remove earwax. All of those things that do get into the ear, such as even suction cannulas and things like that. Now, any of those things that need to go in the ear need to be cleaned, as I mentioned. Now, some of these items are single-use items, and these we just throw out. But other items, such as, for example, these tweezers and curettes, they are surgical grade, reusable instruments, and they're quite expensive. Now, while it's not necessarily required to follow surgical procedures in an audiology practice, I actually take pride in the fact that we do. The reason is actually very simple, and it's mostly really common sense. We often remove earwax blockages for clients who have infections, for example, during the treatment process when, as I mentioned earlier, the doctor asks us to take out what's in there. So, when you want to apply drops, medicated drops to the ear needs to be as clear as possible. So sometimes that means removing wax and substances of an active infection. That could be a fungal infection or could be of bacterial nature. And I want to make sure that we do the very best that we can to minimize the risk of transfer of these pathogens from one client to another in our clinic. Therefore, all reusable items are cleaned in our clinic with a combination of chemical and ultrasonic cleansing. So that basically is to remove all physically present residues such as skin particles, for example. We repeat this process twice actually, which takes around 1 hour for each cycle. After that process, there's a special solution that's called SurgiSlip that is added to the metal products that we use, and then they go into actually individual pouches. And these pouches then we run through an autoclave. An autoclave is essentially a sterilizing machine that is using extremely hot steam for a certain amount of time. There are 6 levels of autoclave sterilization, level 1 to level 6, with level 6 being the highest. The autoclave that we use, that actually works with level 6, the highest method of sterilization. That means actually we are sterilizing products to the same level as any hospital operating theater would use. That's the extent to which we take it here. The autoclave is checked against a test. Every single cycle, there's a little thing in there that tells us if the cycle was successful, and the machine also prints a report out every single time. And then once in a year, that device gets calibrated and reviewed by an external verifying service. You could say that entire process of just sterilizing these instruments costs us around $30,000 a year in equipment, in consumables, and in the time that we need to run these processes. Now, as a business owner, I could save that and I could just add it to the profit of the business. Or I can spend that and add it to patient safety. And I am proud that I've chosen the second option. Because here's the thing, when you come to us at Ear Studio, you do so because you value first-class care and first-class service. And to us, that means the highest standard of infection control that you could possibly apply. You don't come to us because we are the cheapest in town. We're definitely not, but we're also not the most expensive. What we are, though, is a clinic that really appreciates research and best practices. Because they, when applied effectively, they really make a massive difference to what the client receives. So that was just a little bit of information of how we at Ear Studio use best practices in our day-to-day life. That actually came up recently in a consultation when a client asked us why we use tap water. You see, now every clinic can choose how they want to do business. And I wanted to explain that process, which we obviously did, but I also wanted to make that video. Every clinic in Australia here can choose how they want to do business. Now, there's a small group of clinics around Australia that have voluntarily committed to following best practice standards. And if you are interested in finding such a clinic that's near you, there's a link in the description. Now, if you've got any questions about infection control or any other topics that you may want to learn about, please feel free to reach out. Until next time, I wish you all the best and bye-bye.